on. So I'll just start with just introducing myself. My name is Lori Bumbaco. I'm a registered dietitian, but I also am board certified as a specialist in oncology nutrition. I became registered as a dietitian in 2004. Don't tell anyone. It's been a while, but I'm not. So I've been in practice over 20 years. But I've always, as a dietitian, I can counsel anybody. So I can see people who, for example, might have high blood pressure and they want to learn ways that they could eat in order to help manage their blood pressure, and so on and so forth. You can teach. But I've always had a passion to work in oncology. And so in 2008, I took a position at a community cancer center in New Jersey, where I'm from originally. And that's where really I got the opportunity to really grow my passion in working with oncology, and I never turned back. I've always since then only ever worked in oncology. So I became board certified as a specialist in 2009. And every 5 years, I have to take my exam to get my boards, basically, and pass my board, because the practice of oncology, but also nutrition, is so rapidly evolving that we need to stay up to date. A lot of the drugs used in kidney cancer care did not exist even 10 years ago. We all know that. I'm constantly learning. But about 11 years ago, I relocated to the Chicago area, where I am now, and I work in several different areas still in oncology nutrition. My bread and butter is mostly with medical oncology. So I work in a large university health system, and I see all different cancer types who are getting treatment, mostly chemo, but I do see some patients who come in for oral chemo or maybe are just getting radiation. I'm on the cancer committee, so I see people who go for surgery. I get referrals from all different sources. I see people post-treatment in survivorship, and I do that work about 30 hours a week. About 15 hours a week, I work for a nonprofit in our community called Cancer Wellness Center, and I do basically the same work there, where I meet with individuals one-on-one or their caregivers, and they ask me questions. So they ask me like what to eat, what not to eat. They might ask me about supplements or specific diets. And I help counsel them. But also at that nonprofit, I do a lot of different fun educational programs and different groups. And we have a demo kitchen. So I get to do different creative things in the kitchen. And just this week, we did some date bars. So it was like hands-on, and we all got our gloves on, and we were mixing oats and dates and peanut butter and chocolate chips. So that part of my work is really fulfilling, because I think it transfers the science into the art and the food and the fun of nutrition. And I also am just full disclosure, I also speak for Lilly Pharmaceuticals. I'm a contracted speaker for a program that is basically, I travel around the country speaking to different clinics and mostly nurses, some oncologists, about nutrition in cancer care and how they can integrate nutrition counseling to help in their care of their patients. And I have a private practice. I'm trying to think of all the things I do. So I also work in private practice. I have a handful of clients. That is where I really probably do get the opportunity to do my best work, because I have such a small group that I'm really in close contact with them, and I'm in contact with them almost every day if they want it. And that's a lot of fun for me too, because I get to really do a lot of exciting things in private practice with my patients. So, and that's the gist. Does anyone want to know anything more about me? I love what I do, if you can't tell. So I think what our idea was for this, if you don't feel comfortable, I know most of you have your camera off, which I totally respect and appreciate. I wish I could have my camera off for it. But if you want, you could either unmute yourself or maybe even put something in the chat if you have any questions. Now's a good opportunity. I'm actually going to pull out my chat just in case. Or even Linda. Okay, so I have a great question in the chat: how to get your appetite back on your new treatment. So, what a great question. Not always easy to answer. Where I work, I see a lot of people who don't have a great appetite. And sometimes we explore what might be contributing to a lack of an appetite. We might explore questions like, does food taste funny or does it taste off? We might ask about nausea. We might ask about constipation because sometimes if someone's constipated, they don't really feel like eating. Is there pain? Mood? Sometimes if someone's as a dietitian, I like to take that holistic approach. Otherwise, how to improve appetite? Actually, I would encourage you to talk to your medical oncologist about it. There are, believe it or not, there's a drug for it. There's drugs for appetite stimulation, and there's new ones on the market that have been approved for use that I have not personally, but in my practice professionally have seen to be helpful for patients. Where I am, cannabis is legal. And so a lot of times I find that that's a helpful tool for patients who don't really have a desire to eat or things don't taste right. Using cannabis very strategically, and of course, with the approval of the medical oncologist, I find two common themes with a lack of an appetite, two things that seem to help. The first is eating in the presence of other people, believe it or not. So I have some individuals I work with that live alone and will literally eat out. They'll try to at least once a day eat outside the home. And they might eat outside by themselves. So they might go to a restaurant and sit at a table all by themselves, but they swear up and down, left and right. That's what helps their appetite. Just eating with other people who are eating. I have people who are in a family. Maybe they are a young mom and they find, or they're a grandparent. And when the grandkids are around, that's when they seem to eat really well. It's something about that social setting, I think, that really helps to entice and enhance the appetite. The other thing that I think helps with appetite, besides movement and physical activity, is enticing the appetite, right? So is it observing for yourself? Is there something about the meal that looks appetizing? Is it because it's a large portion? Sometimes when we're feeling stressed and anxious about not eating, we feel like we need to force ourselves to eat, or our caregiver forces ourselves to eat a lot of food, when really a small portion might look more appealing. It might look like more manageable for us. So sometimes I suggest us serving a small portion and thinking about cooler foods, because cool foods don't have much of a smell or an odor. And so if that's turning your appetite because you smell the food, you see the food, you smell the food, you don't really want to eat it, right? So sometimes a smaller portion and things that are cooler or room temperature. So things like chicken that you took out of the oven, it was cooked last night, left over, and you pull it out of the fridge and just like slice that up. Sometimes something like that might be enticing, and hopefully that helps. Okay. Is there such a thing as too much protein? Great question, Linda. So we're really important about it's a great question. And yes, there is such a thing. There's such a thing as too much protein for all people, right? And so that's the trick with nutrition. And that's where working with the dietitian is really important and helpful, because the key to nutrition is adequacy. That's the word. And sometimes I like to use Goldilocks as an example. So the fairy tale of Goldilocks, not too much, not too little. We want just the right amount. And so finding just the right amount is different for everybody for a variety of reasons. It could be their medical condition. It could be their age. It could be other medical conditions. It could be drugs. It could be a lot of things, right? So a dietitian assesses all of those variables, does a comprehensive assessment, and then can provide a recommended amount of protein based on that person's need. Sometimes we just simply do it by weight. But two important things are also looking at someone's medical history and then someone's blood work. So blood work will dictate how someone's kidneys are functioning or kidney is functioning. And so then we can determine the adequate amount of protein for that person. Okay, good question. I'm just going to keep going through the chat. I saw someone say on a Facebook post that we shouldn't drink sparkling flavored water. Is that true? I haven't seen that. If you can find it and send it before the hour's up, send it on over. I can't think why that might be harmful for us. I get asked a lot of questions just like that one. I heard I shouldn't do this, or I read this somewhere that I shouldn't do that. And so a lot of times I ask people to literally send me the Facebook post, send me the YouTube clip, send me the article in the newspaper, and they do, so that I can help really decipher and determine what is that all about a little bit. Sparkling beverages, I think, are great for hydration, for mixing it up if you get tired of plain old water. Flavored waters, I think, as long as they're not. I just did an Ask the Dietitian for my nonprofit about food additives, and I went into it with a lot of bias. I thought I was going to give this presentation about how food additives are terrible for us, and now how they're starting to get banned, and they're banned in Europe, but we shouldn't be doing it. After doing my homework and really diving deep into this, I had a different takeaway. I think most of the food additives in this country are generally safe for us. If you want and have money and have access to products that do not use a lot of different colors or different food additives, and you want to choose ones that don't, I support that. I'm okay with that, of course, but we don't have to be afraid that those things are harmful for us. And I learned a lot that there's a lot of misinformation about food additives. For example, you're in the European Union, they actually have food colors that they use that we have banned here in this country. So it's interesting. I think there's a lot of it's a really complicated thing, but we have a lot of protective means that give us good science and good evidence that the amounts that we are getting exposed to are not harmful for us. We're probably not getting too much. And we don't have to be worried that they're problematic for us. Now, if you still have a fear over that, I get it. And I think I support that if you don't want to have colors or additives in as many foods as you can. Hopefully that helps. But flavored, sparkling flavored water, I'm okay with that. I don't discuss the constant question about kidney cancer, if you know, sure. I'm so glad someone asked that question. I answer that question every day, sometimes more than once a day. So I'm going to do my best to answer it. And I think maybe after this recording, even Linda, for those who like registered or signed up, I can send some content too about this, because sometimes in my explanation, I think supporting that with more concrete, black and white information that you could take away and you could read for yourself, other than just watching me spew off my answers. Sugar. So does sugar feed cancer? Technically, yes, it does. Now that sounds really scary. Here's the problem with it. That discovery was a great discovery. It probably started to give rise to my profession. It was made over 100 years ago, which is a long time ago. A long time ago. Since 100 years have passed, we've learned a lot. And part of what we've learned is that we don't know how to exploit that. We don't know how to keep a cancer cell from using any fuel, because they will use any fuel. So cancer cells, besides sugar, also use other things. They use amino acids, and glutamine and arginine is a really good example. Arginine, especially some of our cancer cells love arginine and use that. That's an amino acid that we eat in protein. So we can't really not eat protein. We're stuck there. They also shift and they've been shown to use ketones. So the ketogenic diet doesn't necessarily work especially for kidney cancer. They have been shown to use actually the decay of dying cells. So our cells have a natural lifespan, and once they start to die off, cancer cells will use that for fuel. I like to call them scavengers. They will use anything for their fuel source. And unfortunately, if we try to take anything away, what they do is they just pivot and they adapt. And they say, okay, you took away that, I'm going to use this instead. And so we haven't figured out how to outsmart them in that way. And manipulating that through the diet, I think, is terribly ineffective, because if we think that sugar feeds cancer, all of the carbohydrates, then technically too, all of the carbohydrates turn into sugar, right? So something like blueberries or blackberries, which are cancer protective for sure. Something like sweet potatoes, cancer protective for sure. I recommend oats in almost everybody's pantry. that breaks down into sugar. That's a cancer protective food. So we can't not eat those foods, right? Because at the expense of the rest of our body, we need that good fuel. We need that for our immune support, right? We need that for antioxidants, but the phytochemicals that are in them, they are really what the rest of our body relies on. And so we haven't figured it out yet. But again, if you work with a dietitian, sometimes what we do is we break down the types of sugars in someone's diet and we might make suggestions. So for example, I'll use a good example. I have someone I'm working with. Now she has gallbladder cancer and she also has kidney stones. And her urologist suggested that she drink a half a cup of lemon juice, not straight at one time. I think that would be possible, but he wanted her to basically get a half a cup of lemon juice a day. So she interpreted that to drink sweet lemonade. So, and not quite the same thing. So she's drinking a lot of sugar. And so that's a different type of sugar than if she were to eat like oats with her berries on top, right? Very different. So working with a dietitian can help you understand where to kind of make some substitution, where maybe you might be going overboard and having too much of those simple added sugars because they tend to not be very nutritious and they could be problematic if you consume them in excess and you start to notice your blood sugars become elevated. That's a whole nother component to consider when making that assessment. So that's all part of what a dietitian would do. And I'm rambling off with this answer, but sugar and cancer, it's complicated. It's way more complicated than they make it seem. We don't need to be afraid. Sugar doesn't cause cancer. And if we take sugar away from someone's diet, it doesn't cure the cancer. It just won't. So what we want to do is think about eating healthy carbohydrate, eating a healthy diet, and potentially a plant-based diet, which means mostly vegetarian, not vegetarian, but mostly. So eating a little bit of animal foods so that you're really nurturing the best way possible in your body and supporting your immune system and supporting your gut health too. Okay. Which is coming up. I'm doing something in a panel for Judy Nicholson Kidney Cancer Foundation on the gut, the microbiome and how immunotherapy might be able to manipulate it through the gut microbiome. And guess how we can manipulate the gut microbiome? One of the best ways is through diet, which is really exciting. And what we would advocate for is a lot of plant food. That's a lot of carbohydrates, right? So the microbiome we can support and have a diverse, well-functioning gut microbiome. It may make immunotherapy work better if we feed it the right way. All right. So sign up for that if you haven't. That's going to be really exciting. And maybe Linda will put it in the chat too. We're going to talk about it after. Any more questions about sugar? Did I address it adequately? It's a tough one. Okay, so I'm just going to keep going down the chat. My husband is on carbo, 40 milligrams based on UK. He's finding that his stomach is upset after eating some meals. No particular food would be fine. Peppermint tea helps. Yeah. Yes, a lot of people I work with too, that's what they describe, just like an unsettled stomach. It's not really nausea. They don't describe it as nausea. So a lot of people I work with in clinic, we find that small meals, and it might be 4 meals, it might be 5 meals a day, it might be 6 meals a day. Sometimes you hear 6 small meals a day. I think it's whatever works for you, right? But smaller portions more frequently seem to really help make a difference in terms of settling that queasiness in the stomach. But also too, if you're finding such as having a small appetite, if you're filling up on a small amount of food, just give yourself a small amount, and then come back to it 2 or 3 hours later. It could be half portions. It could be an entirely different meal. And sometimes we think about really small portions that carry a lot of nutrition. So things like peanut butter with some crackers, or maybe a little bit of fruit with peanut butter. And that is really going to be very nourishing. It's high in energy, high in protein, and plant proteins especially, or smoothies, because they seem to be, you can really maximize the nutrition in a smaller volume or a smaller dose. So that seems to sometimes help. But peppermint tea, I love that too for quieting down a stomach. It's not always great for acid reflux. So if you have reflux, I wouldn't do peppermint tea necessarily. But if you have an upset stomach or even lower digestive issues, peppermint seems to be very therapeutic for that. Same thing, sugar feeds cancer. And so common, right? We call it a myth because it's not fair for us to get exposed to that sugar feeds cancer. That insinuates that like if that nothing else feeds cancer, when technically everything feeds cancer. We have data to support that. And researchers have tried to take sugar away from cancer cells and they can't. What they find is even within a solid tumor, cancer cells behave differently. So some will use sugar, some will use fat, some will use amino acids and proteins. So even if it's wild how metabolically strange cancer cells operate. They don't operate in a normal way. And that's how cancer works anyway. They don't follow the rules. They misbehave, they break the rules. They're little buggers like that. And so again, because we just don't have the answer yet, and it seems more complicated than just sugar feeding cancer, it seems like everything feeds cancer. What the focus hopefully needs to be, and I've noticed it in my work, is that if you give yourself a mostly healthy diet, which includes sugar once in a while, that means that you're going to support the rest of your body cells and building that strong body, that resilient body, and nourishing that body is what's going to help the treatment work better. And so nutrition is a complement to the treatment. Okay. Can I give you a list of cancer protected foods? I sure can. That's something I can send as well. One of my favorite resources is the acronym is AICR. And I'll even put it in the chat. It's AICR.org. That's the American Institute for Cancer Research. And they really are the experts on diet, lifestyle, and cancer. And so even following the diagnosis of cancer, they recommend eating mostly a plant-based diet. So if you think of any minimally processed plant food, and you can go through the list of vegetables, the list of fruits, the list of beans and lentils, nuts and seeds, or whole grains, those are at the top of the list. Some have a little bit more of the cancer-fighting compound in them, but they're all great because they all have something to offer. And they're all different. And that's where variety and diversity in a diet is key. Not only that, but also herbs and spices. I always forget those. They're plants too. And they have all of these. And historically, they were used for medicine in that way, like peppermint. So they have these different properties that exert in preclinical data. So meaning in animal studies, in vitro studies, so like in test tubes and petri dishes, they exert these cancer fighting properties. So whether they like kill off cancer cells or they stop the spread of the like anti-angiogenic, meaning stopping the blood vessel supply of a tumor, or they might work with antioxidants, where they kill, or they have pro-apoptotic effects, where they see cancer cells lack the ability to kill themselves when they start to morph and mutate. And so that's called, but normally, normal healthy cells die, they kill themselves because they're like, wait, I have to commit suicide because this cell is getting damaged. I'm not being helpful for my host. And so some of the compounds that we find in plant foods are pro-apoptotic, as we call them. Some are anti-inflammatory in terms of the compounds. And so we know how complex the disease of cancer is. We want a vast array of all of those compounds. And that's where you'll hear dietitians say, oh, whole food plant. I will definitely send some content about that as well. Okay. But on AICR.org, I have it like bookmarked. They basically they're part of a global consortium. So not just studies that are done here, but research done internationally. And you may be aware, internationally, they're a little bit more pro nutrition, and they do a lot of different research studies about the preventative nature of some of the foods that we eat, which seem to still be protective once someone's been diagnosed. So they tap into that research as well and really help give us some really important takeaways and guidelines. And the evidence for it is building and getting stronger. And it's really exciting because we haven't had it up until this point. And that's might be why your oncologist or any of your physicians might not necessarily think food matters much. They might say, yeah, nutrition doesn't really matter. And that's because the evidence isn't the same type of evidence that they let, not quite the same. And so it's in recognizing that, that's why I say that nutrition is a complement. Nutrition is never meant to replace medical intervention, right? It just helps it work better, basically.
Hey, Lori, I just want to
Yeah.
tell you, I'm taking notes.
Okay.
I'll get you everything so you don't have to worry about writing it down.
Thank you. Yeah, because I just keep rambling. All right. Thank you, Secretary. Okay. So cancer protective identical. Is there something to turn off taste? Okay. So all food tastes bad to him and he's losing so much weight. I love working with individuals whose taste is off. So here's the best thing I can recommend. If anything tastes normal, and it might be one single thing, Margot, it might be one. Use that one thing. So for example, today I was with somebody, he has an esophageal cancer and he doesn't really have much of a taste. It's not food tastes bad, but he doesn't really have much of a taste. So like he's not eating as much. Like he's not liking bread. It's just doesn't taste the same. And he's a foodie. So it's killing him. If I wanted to just eat and enjoy food. But and then he started talking more. I had this salad and it had a balsamic vinaigrette on it. It was the balsamic vinaigrette. That was the game changer. So he's going to actually try to dip his bread in balsamic vinegar or a vinaigrette named with balsamic vinegar. And that's probably going to be the vehicle so that it tastes better. I don't know if you came on earlier, but I'll mention this second. What I would recommend is oral care, so rinsing the mouth, because if he has a bad taste all day, he probably doesn't want to eat. You can ask him that. Do you have a bad taste in your mouth? You know, when you don't eat. If he does, then rinse the mouth out, especially before eating. Some people use plain carbonated water or plain tea and swish it around in their mouth. It clears things up. I've had patients literally use coconut oil, a spoonful of coconut oil, and rinse it around in their mouth, spit it out to just clear their palate. And then maybe he will want to eat. You could also ask about dry mouth. If you have a dry mouth, because that could be treated. And I've had patients brush their tongue before they're going to eat. And if he's using mild products, he can do that as often as he wants. We don't recommend necessarily alcohol, not like rinses if you have a dry mouth. We wouldn't recommend that. So sometimes that's helpful, but I would see if there's literally one thing that helps or that actually tastes okay. And then, so for example, I'd like to give lots of examples. I had a lady once who she was on treatment and her husband, she was responsible for meal prep at home. And now on treatment, her husband was taking on that responsibility and he made a lemon chicken and he made it all wrong. And he added way too much lemon, but she loved it. And she was like, it was the extra lemon. And that's what it was. So lemon's a really easy one. And that's really common. Like you could use lemon on a lot of different things because it's the lemon that's what's allowing her to eat more because it's the lemon she tastes and she likes. So that might help. I've had patients use ranch dressing because they found ranch dressing tasted good. So they would carry ranch dressing with them in their bag. Just pull it out and just dip a sandwich in it, put it on their eggs. Lots of different examples with that, but hopefully that helps. Okay. I mentioned at the start with appetite that cannabis, because it's legal here, we use it a lot in clinic. Cannabis seems to help with taste changes in my observation. So that if that's an option for you and you want to talk to your oncologist about that, sometimes that can help with taste changes too, in my observation. Okay. Should we be vegan? Would that be best? And my girlfriend is vegan and some other food she eats, I couldn't do it. No, you've been here. A lot of people think I'm vegan, and I said, no, not at all. We don't think so. And I think the science is out, and I think it depends. The debate is still being debated. It depends who you ask. Some people will say, yes, vegan's the ultimate, but not my understanding. My understanding is mostly plant foods, and that may look different to different people, right? It might look like 75% plant foods, 25% animal food. It might look like 2/3 to 1/3. It might look like 80/20. But the inclusion of the animal foods is nourishing. So if you think, I think right off the top of my head of yogurt, a fermented source of probiotics that's good for the gut, which might be relevant for someone on immunotherapy, or kefir, another source of a fermented dairy, which is a source of probiotics. Fish, is some fish that we eat are very high in omega-3 fats. Omega-3 fats are great for us, and most Americans are not eating recommended amount. I think there's a value to some of the animal foods that fortunately, we don't have to avoid because they add value to the overall diet. And red meat, even good old red meat, there's vitamins and minerals, right? There's protein, and we don't have to eat a lot of it. Americans we tend to eat a lot of animal food and not a lot of whole plant food. So if we could just think about switching up the proportion, we're probably going to head in the right direction right off the bat. Because I also think, I'm going to share this, I also think that you can get stuck into a rut if you eat vegan. If you don't really love it and you're feeling forced to do it, you might not really have fun with it and explore new foods and new ways to prepare food. So you might get stuck in a rut. And there's a lot of vegan foods that are technically vegan that aren't very nutritious, to be honest. You could eat like a big old bagel. I'm from New Jersey, bagel store bagel. They're like this big of my head. That could be vegan. We could probably do better than that. Or a lot of the like alternative products nowadays that are on the market, I don't know that they're necessarily better than the original form. So a good example is some of our substitutes for ground beef. I think ground beef, it just is what it is. Same with butter, it is what it is. So if we use it in smaller amounts, it's only going to potentially add value, right, to our diet. It's not going to be harmful, especially if we're eating so many other healthy foods. Okay, so hopefully that helps. I think Rick Simpson oil, have I ever heard of that? I have, but I probably would need to look it up again because it's been a while since is that supposed to be helpful is it like a treatment, or is it for Rick Simpson oil? I definitely have to look that one up. Here's the thing. I feel up to that. Okay, here's the other thing too. I'm in the business of helping give information. That's why I willingly do things like this. I'm spending my time, something to do with cannabis. So okay, so I'll come back to that, but I just want to finish I'm like ADD tonight. Thank you, Linda. I'll get to that one too. Okay, so I'm in the business of giving information. I'm not here to tell anyone what to do unless they ask me. I'll tell them. But I recognize we are bombarded with misinformation and sometimes disinformation, which means harmful information. And in my experience, I've worked with individuals who have used words like, I panicked and I cut out sugar and I lost 20 pounds and I look like a skeleton. And I didn't even see my oncologist yet. It's because I read something on the internet. And she panicked. And that to me is so unfortunate because that's not the role of food in our life. I don't think so. Food is meant to really be an help, not our enemy. I had someone literally cry to me because she felt guilty because she was not vegan. She went vegan once she got diagnosed, but she thought she gave herself cancer because she ate animal food, which isn't the case. That's not true, right? But something she read somewhere made her feel that way. And she was very distraught. And I just think that the distress and the anxiety of the exposure to that misinformation and disinformation is more harmful than food could ever possibly be. And that's something I'm looking for the people that I work with or anyone I get a chance to speak with. I'm looking to avoid that or minimize that. And really instead empower the person to feel confident that they know where to source trustworthy information, that they are the foods that they're putting into their body historically and even moving forward are the best choices they possibly can do. and that it doesn't have to be perfect. That's the most refreshing thing about all of this. The experts build into guidelines these limits on things. It's like a budget. So as long as we're staying within budget on things like sugar, okay, it's okay. And then also integrating other components of our lifestyle. Are we getting adequate rest and sleep? Are we moving our bodies? Our bodies love to move, believe it or not. They need it. They thrive on that, especially for an appetite and digestion. Movement's really key for that. We can't help that we have stress, but acknowledging it and working with it, I think is really important. And I think if we're going to really be helpful to mind and body. Okay. So thank you, Linda, for doing the research. It's high in THC and it's unlike. So here's the other thing I would say before it became legal here, people would maybe their friend was going to Colorado and would pick some up or they'd get some. I think if you have a dispensary and your oncologist will kind of it, that's what we prefer. Is it's more to guarantee that you're getting a pure product. It's been regulated. You know what's in it. They can track it if there's any response to it or reaction to it. I visited dispensaries for myself because I want to know what my clients and patients are experiencing. And I've been pretty pleased. And I've heard really great stories. I think we'd be remiss if we didn't have it on the table as an option sometimes for pain relief or for nausea or sleep, because we know that's so crucial for someone to feel well while they're getting treatment. I think a lot of times people I work with suffer and they really don't have to, or they feel like they need to because that's the way treatment is supposed to be. When I don't really think that's necessarily the case nowadays. We've come a long way. Okay. I'm going to keep moving. Okay. Are there food that should be avoided or added if you have gastritis? Which food? What I would suggest, so with gastritis, what foods help, what foods harm? Hopefully that's being managed medically, right? And the right medications are being included and they're on board for that. I always think with digestive concerns, really helpful thing is a food journal, believe it or not, because everyone's different. So I think with gastritis, I would recommend right off the bat having smaller meals and not a large meal, having generally lower fat foods because fat can be aggravating to the stomach in large quantities. So just smaller amounts of that, smaller amounts of acidic food, and then also maybe obviously spicy food. So then, and what I prefer to do in practice is go through ideas for what to eat instead. So I would really work with that person using their food journal to identify maybe if they have certain triggers, certain times of day when the gastritis might kind of be triggered, and then include foods that will work, right? So more bland foods, things like our carbohydrates, they're best for our digestive tract. And that's what's so great about carbohydrates, right? More bland things like some toast in the morning with long, soft protein, or even something like cottage cheese with the toast in the morning. I think liquids are going to be probably better tolerated too, right? So if someone's used to having salad, we might talk about having a vegetable soup or making a smoothie using some vegetables. It's funny how you can sneak that into a smoothie and make it taste good still. And then slowly adding on more and more things as hopefully that gastritis improves. And that really the other important thing with nutrition recommendations that they typically are given like in a snapshot of time. And we want to always reassess them and see are those initial recommendations still working for us right now? Or do we need to pivot and change some things? I'm just seeing everything. So you might have caught that Linda put in the chat July 24th at 7 Eastern. We're doing a forum. So it's on probiotic use and how to, of course, as the dietitian on the panel, I will be talking about food forms of probiotics, but then also a really important concept called prebiotics, if you haven't heard about them. So prebiotics are special fibers that are in some of our plant foods that uniquely go to the beneficial microbes that are in our gut and they feed them. And so when our beneficial microbes are happy, they're going to thrive, they're going to replicate, they're going to crowd out the harmful bacteria and other microorganisms that are in our gut. And so it's really exciting that change or the change of the diet can affect our gut microbiome in as little as 24 hours, which is really cool. Really exciting. I've always been fascinated by the microbiome. So if you have a little bit of interest in that, I think it'll be a great panel discussion. Sometimes people ask, and plus two probiotics. Most of the probiotics on the market are very specifically designed. So there probably is a probiotic for gastritis. I'd have to look it up. And there's a resource to do that. And of course, a medical provider could look that up for you too. But not all probiotics work for the same thing, right? So again, that's where we've come now to the point with nutrition therapy that it's personalized, it's tailored, it's personal, just like medicine is personalized. So it's really exciting now. That's where nutrition is. And so even with the answers I'm giving to the questions today, I think it's always a great idea to think about, does this make sense for me? How does this apply to me in my situation? Because you're unique. And I think that you're only going to really understand that best when working with a dietitian. Great question so far. Okay, so another question. Are supplements good or bad to take? Again, it all depends. What does it depend on? So I will give you first, before I answer this, full disclosure, I'm a dietitian. So I believe that we should probably get our nutrition from food rather than from a supplement. There are exceptions. Sometimes someone has a clinical deficiency of a vitamin or a mineral, and they can't possibly eat enough of it, or they don't absorb it or digest it the same way. Maybe they've had surgery, or like my esophageal patient, he's going to have an esophagectomy. So he's probably going to need some vitamins and minerals for the rest of his life because his stomach is going to be altered. And that anatomy is going to affect the way he can digest and metabolize his vitamins and minerals. So that's one example of an exception, right? But or for an example, someone with osteopenia or osteoporosis, and maybe that individual, despite trying everything in his or her ability, cannot eat enough calcium. And the doctor recommended more calcium in their intake. They might need a calcium supplement. So it really all depends. But most of the way that they're marketed makes it seem like we do need them and that they're more powerful and potent and better than what we might get through food, when we don't see any evidence to support that. And in the case, there are some exceptions that I shared, but for most of us, depending upon who you are, most of us probably can meet our nutrition needs through diet alone. And when we eat, and that goes back to the concept of just eating enough. A lot of times in this country, we often think the more of something, the better, right? So like vitamin C, for example, we know vitamin C has a role with regulating our immune system. So great for us. But in cold and flu season, there's a lot of vitamin C products available, and we might ramp up the vitamin C, falsely assuming that it's going to boost up our immune system. When that's just not the case. And too much vitamin C has side effects. So it can cause diarrhea, it can cause kidney stones. And so we just want to take just enough, right? And that's, again, working with a dietitian. I have a patient who I saw yesterday. She's on a diuretic. And I asked her how, and it causes her to lose potassium. And I asked her how her potassium levels were with her blood work. They've been fine. However, I want to encourage her to eat more foods that are high in potassium. The foods that she's going to include are fruits and vegetables, which not only do they have potassium, but they have a lot of fiber. They have maybe some magnesium in them as well, which is great for her. And also the phytochemicals, antioxidants. They're going to be anti-inflammatory. They have other cancer-fighting compounds. So for more reasons than one, she can eat in a way to satisfy all of those goals. We're taking a supplement. It's not even regulated. We're not even sure if it has what it says it has in it. We're not even sure if it has something else in it. Some of the products that are tested, not also the common ones, but weight loss supplements and sometimes like performance enhancement supplements, like what bodybuilders take. Sometimes they find prescription drugs in those products. For example, red rice yeast was on the market a while ago, and they actually found it had statins in them. So no wonder why it worked, which is really dangerous. So we tend to, and that's the reason why we tend to recommend food first with those exceptions in mind. Where I am, and I'll just share this too, where I am in clinic, we have a pharmacy team. And so the pharmacy team and I tend to review supplements together. So if sometimes people come in, they heard this product was good for them, or like their neighbor suggested they take it, or maybe they historically took a supplement for some reason. And we just review that and we check it's not contraindicated with their treatment or with their condition. And then we give it the yes or no. Great question. I'll be to that one next. Yeah. I had someone, I love sharing stories. So I would just want to share this one. I had someone who I met cycle 3 of his chemo treatment, and he was taking turmeric and he had gallbladder cancer. And every time he took turmeric, he would get like this, like abdominal like discomfort, a little bit of cramping and turmeric. And he figured it out that it was the turmeric causing it. And he was right, because turmeric can induce gallbladder contractions. And so anyone with gallstones probably should not be, and we don't always know if we have gallstones, probably should not be taking turmeric supplements. Now, eating turmeric is a different story, because the amount we eat in food is so much less and it's less concentrated. So it's like you get smaller doses of it throughout the day rather than one big whopping dose in a supplement. So that's the distinction there. And that's why when we turn to food, we know we're going to get smaller amounts, and we know we're also going to get a package of other compounds and nutrients inside that food. And turmeric's a good example of that too. Is alcohol really bad? It's not great. It's not necessarily linked with kidney cancer like it is strongly linked with other cancers like colorectal cancer, our digestive cancers, otherwise like esophageal, head and neck cancers, or breast cancers are linked with alcohol consumption. Some general guidelines suggest that we really limit our consumption to one, no more than 1 a day for women, no more than 2 a day for men, and they metabolize it differently. Believe it or not, that's why. Not because men are bigger, they like have the enzymes that help them metabolize alcohol, which is funny. So generally speaking, we tend to recommend, really just following those guidelines. And that's a great question. And I'm just going to keep going with the alcohol. Is wine better than beer or hard food? Not necessarily. They're all in the same category. I think wine has this reputation, especially red wine, right? Because it has resveratrol. But resveratrol is so high in other fruits and vegetables, like cherries are a really good example, or other berries. And it's even in peanuts, believe it or not. I was snacking on peanuts earlier. So we don't need to drink the red wine for the resveratrol. We can eat the food form and get a higher amount of it, and also get some other important nutrients in our food. Okay. Then mocktails are all the rage right now, at least where I am, which is really cool. So we can still be social, have fun, and have a non-alcoholic drink. I feel like we're still having time, especially this time of year, having a good time with that. Many of us with kidney cancer have one kidney, the recommended amount of protein. That's a great question. My understanding is that a third of a functioning kidney is what it typically takes for us to maybe consider dysfunction in terms of protein. So a lot of what I look at, and I work with the nephrologist on this, it depends on the situation. If someone's eating pretty well, we might, and have a good appetite and doing okay, and like things are looking good, we might talk about more plant proteins, because that is better for kidney health anyway. If someone's struggling and not eating great, we tend to loosen up on diet restrictions during active treatment. So it really depends on that. I would say that's an important consideration to make, but I very often will work with a nephrologist directly to talk about that. And we look at blood work, because that changes so often. But my patients that come in, if it's at least once a month, we have an idea of where they're trending. And if GFR starts to dip until the 20s, that's when I start to maybe think about it. I'll ask someone how much protein they're eating and really just explore in their food choices how much they're eating. We might take away protein supplements, because those are so popular too for many people I work with, or maybe look towards plant protein that and have a metabolically, it has a better impact on the kidneys. and preserving kidney function and return back those plant proteins. So beans and lentils, our whole grains and our seeds, especially like hemp seeds or pepitas, great source of plant protein, and really also too cancer protectant in a lot of other in a lot of other ways too. So sometimes we'll look at that. And to protect the remaining kidney, I always think about fluid status. So how does someone have someone's fluid status in terms of their bodies? Are they hydrated, especially this time of the year? It's really hot where I am. So we talk about that. We also look at blood pressure. So if blood pressure is off or elevated, we also look at a plant-based diet for that as well. It's so funny how it seems to accomplish everybody's neat goals on everyone's list. So the DASH diet is the dietary approaches to stop hypertension. And this is clinically researched, really great data that way of eating. And they have a great website. I'll put that in the chat too. This is a version of a plant-based diet. And it's really helpful. It's not vegan, but a version of a plant-based diet. They put that up against an antihypertensive drug, and it did better than the drug at lowering and managing blood pressure. We were so excited about that. So the DAX diet, so if that's also a consideration after surgery, that might be helpful as well. But also, too, if you're just looking for inspiration toward the plant-based diet, the DASH diet might be appealing to you. The website, so just Google DASH diet, and the website is amazing. They've updated it. There's lots of resources, recipes, meal plans. There's even books out there on it. I think it's a great way of eating too. Okay. I hope it's helpful. I know we're close to time. Just want to see if there's any remaining questions or any thoughts or anything else to share. Thank you, Linda. And so I've been talking about how thank you, Terry, thank you. And thank you everyone for being here and giving me a chance to speak. I work in private practice because not everybody that's diagnosed with a cancer has a dietitian at their disposal like I do here in clinic. So I think that's a shame because so many people have questions and you just want answers and you want to feel confident that you're doing the right thing, or you may really need detailed planning and diet planning. That's what a dietitian does. And an oncology dietitian like me, I just have so much experience that chances are I've encountered similar experiences to what someone is going through. And I have not only just from my understanding and my practice, I have the experience. So what works for some people, sometimes I can share that with others. And then that's a really important takeaway. But it also helps just empower you, I would say, because only we get to decide what to eat. And we're not in control of a lot of things. And at least harnessing that ability and that opportunity to tap into something like food is really powerful. And I think we know it improves outcomes. So that's the other thing, right? So there are more and more oncology dietitians on treatment teams because, and I speak around the country about this, because we know it matters. So nutrition counseling has been shown to help improve outcomes. If someone becomes malnourished during their treatment, and it doesn't matter if their cancer is curable, that malnutrition is going to change and influence them to have worse outcomes. So we don't want anyone to become malnourished. That's really a priority for those people. But for many other people that I work with, they just want to they want to improve quality of life. They want to reduce any stress over what they're eating. They want to have more energy. And we know that nutrition has a vital role with all of those things. And so, again, one-on-one counseling is only going to afford you that. There are a lot of general recommendations out there, but I also think there's a lot of things I go on. I'm a new mom. Forget about it. I'm like, oh, I'm not doing this. I got to do this. There's so much pressure. You feel like you're not really sure. It gets overwhelming sometimes. And so a dietitian's job is to really streamline that and really make sure that we prioritize goals and just chip away at them little by little. And before you know it, you're living and breathing the way that you really intended to in terms of your nutrition goals. Yeah, and Linda included my email on there. I'm happy. In Illinois, I do take insurance. So some people I work with are covered, and they're happy to meet with me because their insurance plans cover it. But We have a lot of other things that I'm doing through my private practice. Like we're doing a lot of post-treatment survivorship programs, which is really cool. So if you're interested in that, just reach out. I'm really excited to be able to offer a lot of these things at a pretty low cost. We check around. I know what other people charge. And we know that our mission is really just to get the right trustworthy information out there. And so we're happy to do, and we know the economic burden of oncology care. I know it, and we appreciate that. And we keep that in mind with everything. Thank you all so much for giving me the chance to be here. Thank you, everyone.